When we talk about social isolation or loneliness, and they sound extremely similar, but they're very, very different. And I'm just going to outline what the differences are between these two terms. When we're saying we're feeling socially isolated, which is possibly what's happening to a lot of us right now with COVID-19, uh, all of us might have like a person that we connect with. I know I have a core group of 5 or 6 people, and that is my social group, right? Um, I haven't seen them since whenever this started, right? So I'm feeling socially isolated, but I'm trying to make it a point, trying to connect with them virtually, right? We might be doing Zoom platforms. So like when we're saying social isolation, this is an objective phenomenon. What that means is that right now I'm not connected to those 5 people on a weekly, monthly, whatever sort of basis. I'm not seeing them, right? But if I was feeling like even with in terms of like if I was feeling lonely, that is very different. So social isolation is that my core group of 5 is not there. Loneliness is I could have my group of 5 around me. I could be surrounded by people, but I don't feel connected to them. So it's the gap between what I'm feeling, what we're feeling, and what we need from like what type of a connection do we need from a person. So loneliness does not have connection. Social isolation has that distancing factor in terms of like I'm not able to physically see or connect with people, right? Loneliness is subjective. It's more about what we're feeling. When we talk about social distancing, this is really important right now to like keep safe. We all need to like keep that 2 meter distance going on, that 6 feet apart when we're going for walks or anything of that sort. But they didn't say, they said socially distance if you're going out and connecting with the people that you're close to. They didn't say socially isolate yourself. That is not what like the social media or anything is saying. So that is like something I want everybody to remember. Social distancing does not equate to social isolation. um, Loneliness, as I mentioned, it's like the quality of our connection, right? So that is something that we can all work on. Now when it comes to both these things, and we've talked about what the differences are, guess what? They both come along with health risks. And the health risks are really, really interesting because I was doing research on all of this. And it's when they talk about the health risks are comparable to obesity. Um, you could be feeling lonely, and your like the rate of mortality, that level increases by about the risk of mortality increases by 30%. That's pretty high. Um, and this is according to a study based in 2015. Something else that they found with loneliness was that, as Dr. Asna mentioned, mental health, like there's a decline. There's a decline in cognitive functioning. There's like it sort of starts going on and impacting us in different manners, and other sort of mental health issues might crop up, like depression, anxiety. What do we do with that? It's not just our mental health, it's our physical health that declines, which was like briefly discussed as well. So something that's really interesting, loneliness equates to, it's as lethal as smoking 15 cigarettes a day.
Wow.
So that was like a very interesting research that was done by Julian Holt Lundstedt. So that is like eye-opening for all of us.